Michael can see the settings, so it should connect to that.
Okay. So good morning to everyone. Let's start the introduction. Let's start the introduction to pharmacoeconomics. Can you all hear me?
Yes, ma'am.
Okay, fine. All right. Now, pharmacoeconomics is a branch of health economics, okay, which particularly focuses upon the costs and benefits of drug therapy. I was telling you the other day about the drug therapy. So this deals with how to calculate the costs and how to look at the benefits of a particular drug therapy. And it can be defined as a branch of health economics which deals with identifying, measuring, and comparing the costs. Cost is usually expressed in monetary terms, and consequences, which are expressed in terms of monetary value, efficacy, or enhanced quality of life of pharmaceutical products and services. Now, pharmacoeconomic research, it identifies, measures, and compares the costs, as I already told you, and consequences. The costs are the costs of the resources consumed, and consequences can be clinical, economical, and humanistic of a pharmaceutical products and services, and their impact on individuals, healthcare systems, and society. Now, before prescribing any new drug therapy, two questions must be answered. Number one, whether the new drug is equally or more efficacious in the said disease as compared to the standard treatment. Second, does the new drug have any economic advantage over the existing drugs? Now, what is the need for pharmacoeconomics? The demand and the cost of healthcare, as you all know, are increasing in all the countries. Across the world, patients are affected by high price of medicines. In developing country like ours, 85% of a total health expenditure is financed by household out-of-pocket expenditure. Many poor people, they frequently face a choice between buying medicines or buying food or other necessities due to limited resources and high pricing of drugs. Because of the rising costs of healthcare, one should get the best value in healthcare for the money that they spend. Now, pharmaceutical expenditures, which constitute a large part of healthcare expenditures, have been increasing much faster than the total healthcare expenditures. There is definitely a need to find optimum therapy at the lowest price. And pharmacoeconomics offers different methods that help to choose the best treatment option, which is most economical. Now, some definitions we will go through. The first one is the cost. Cost means the total resources consumed in providing a service. Price is the amount of money required to purchase an item. Drug effectiveness is a term that we generally use. It refers to the effects of a drug when used in real life situation. Whereas drug efficacy means the effects of drug under clinical trial conditions. Consequences are the effects, outputs, outcomes, or results of the program of drug therapy of interest. Now, the cost and consequences are the important part of pharmacoeconomics. So they are the two major components for any pharmacoeconomic evaluation. So I already defined cost, but I'm redefining it. Cost is the total value of resource consumed for drug therapy of interest. I told you the other day, it is not necessarily only the drug. It could be the oxygen. It could be the how much money the physician is charging for a visit. It could be the bed charges. So it's the total value of the resource that is required for drug therapy. And consequence is the clinical outcome of drug therapy of interest. What is the outcome of drug therapy? We will go in detail about it. Now, the cost is categorized into three costs. One is the direct cost, second, indirect cost, third, intangible cost. Direct medical cost, this is what is paid for specialized health resources and services. This includes physician salaries, acquisition cost of medicine, consumables associated with drug administration. It could be syringes, for example. Then staff time in preparation and administration of medicines, because you have seen the nurses preparing the medicines for administration. Then laboratory costs for monitoring effectiveness and adverse drug reactions. Then salary for healthcare professionals, time and services. That is salary maybe for the pharmacist, salary for the nurses, salary for the physiotherapist if he is involved, and cost of hospitalization. Now, direct non-medical cost includes the cost necessary for the patient to receive medical care other than the medical cost. That is, suppose a patient comes from somewhere, to receive the medical care. So he has to pay for the lodging. So that cost, special diet if required, then transportation, then lost work time, important for employers. So, I mean, for those who are not working, it is not applicable, but those who are working, it's a lost work time. Indirect cost relates to any losses that are incurred to society as a result of the disease and treatment. This is the cost incurred by the patient, family, friends, or society. Now, many of these are difficult to measure, but should be of concern to society as a whole. And this includes loss of productivity from a disease, which can affect the patient, his family, and the society. Suppose somebody is affected with cancer, for example. The whole treatment would take about 6 months. So there is loss of productivity from that disease, and this can definitely affect the patient as well as his family and the society. Then unpaid caregivers. So suppose, again, the same example if I take, so that some caregivers may be required. So the house people may be, serving the patient. So they are not paid. So their time also. Then lost wages or salaries due to the disease. And expenses of illness borne by the patient, the relatives, friends, employers, and the government. Because some relatives may come to visit the patient, friends may, put in some money, employers also may be able to give some money for the treatment, all those expenses. Then loss of leisure time, and sometimes the patient may have to resign from the job. So resignation of the jobs due to inability to work. Coming to the intangible costs, these are the costs related with the non-financial outcome of the disease and medical care, which cannot be expressed in money. See, the patient undergoes so much of problem, everything cannot be counted with money. So those non-financial outcomes, such as patient's anxiety, pain and suffering, worry and other distress of the family members of the patient, effect of quality of life of the patient resulting from the illness, poor health and the treatment. So all these, what the patient goes through and the family members also goes through, all this cannot be equated to money, but they are very expensive, much more than the money, I would say. For example, patients of rheumatoid arthritis, cancer, or having terminal illnesses in which quality of life is affected due to adverse reactions of the drug treatment. The best example I would say is chemotherapy, because so much the patient goes through in this treatment. Then health, let's go for outcome now. We saw the cost, and now let's see what is the health outcome. Now, health outcome measures the change in the health status of an individual. That is, supposing the patient has an infection. Now, after the intervention, the infection is gone. So, supposing he has high sugar, after the intervention, the sugar levels are normalized. So, there is a change in the health status of an individual due to the intervention, and that change is known as the outcome. Now, typical health outcomes which are used here are cure rate, that is, percent cured of illness, improved quality of life, supposing it is not curable, or it may be curable, but the quality of life also may be affected, like in case of psoriasis or COPD. So, what is the improved quality of life? Then decreased incidence of morbidity, then years of extended life as in case of cancer, then relief or reduction in the symptoms, then therapeutic failure, then adverse effects due to drug interactions and side effects, then even mortality. There is something what we call as eco model. These are nothing but the outcomes, the economic outcomes, the clinical outcomes, humanistic outcomes. That means what I want to tell is the outcomes are classified into three: economic, clinical, and humanistic. So what are the clinical outcomes? It could be the efficacy, it could be the safety, and the adverse effects. Economic outcomes are work productivity, direct medical costs, resources consumed. And humanistic outcomes are the satisfaction, tolerability, and quality of life. You can just imagine one disease so that you can relate. You can think of cancer, for example. So what is the efficacy? What's the safety for the patient? What are the adverse effects due to chemotherapy? Economic, what's the work productivity? Whether he has lost any productivity due to he's not able to go for work. So what's the loss in the productivity? And direct medical costs and resources consumed. And the humanistic could be satisfaction. Is the patient satisfied with the treatment? Is it tolerable for him? And whether his quality of life is improved. So this is, in conclusion, we can say, in developing countries like our country, poor people are not able to afford the expensive medicines. In this context, pharmacoeconomics plays a very big role in deciding the drugs with minimum cost without compromising the efficacy. And pharmacoeconomics needs to be brought into practice to ensure that society allocates healthcare resources wisely, fairly, and efficiently. I think you are able to understand this because with that introduction what I gave you the other day, I hope you have understood. Thank you. And if you have any doubts, you can revert. You can let me know the doubts so that I can clarify. This was only an introduction. In the next class, I'll take up the different methods of pharmacoeconomic evaluation, such as cost minimization, cost effectiveness analysis, cost benefit analysis, and cost utility analysis in detail. We will take it up. So hopefully you understood the introduction and become familiar
Yes,
with
ma'am.
all the terms. Yeah, any doubts you can ask.
We will ask in the review.
Is it clear to you? Whatever has been, have you understood? I'll give you the presentation
ma'am.
also. You can take the presentation also and go through. Okay?
Yes, ma'am.
Yes, sir.
Yeah. So if there are no doubts, then I'll end the session.
Okay, ma'am. Thank you, ma'am.
Okay, ma'am. Thank you.
Okay, okay. See you in the next
Okay,
class.
ma'am.
Yeah, okay.
Yes, ma'am. Thank you.